The MV Hondius is in Rotterdam today. PHAC has named a confirmed BC case, and the CDC has finally put out its first public guidance using the words Andes virus. So, at least for the moment, we're getting answers, not just alerts.
I'm Brian, and I want to go line by line on that CDC FAQ. Because if a frequently asked questions page can't tell you when to see a doctor, what's it even for?
I'm Cassidy. Today on Hantavirus Watch, what PHAC's BC confirmation means for the 22 other countries passengers scattered to, what the crew quarantine in Rotterdam actually looks like, and whether the CDC FAQ gives us anything more concrete on exposure thresholds than ECDC did.
And Ushuaia is now taking an economic hit with a name on it. AP has the first sourced story on what Andes virus is doing to the Antarctic cruise hub. And yeah, it's not pretty.
From Centers for Disease Control and Prevention.
CDC is responding to a deadly outbreak of Andes virus, a type of hantavirus, among passengers and crew of a cruise ship in the Atlantic Ocean. CDC staff are among the world's foremost hantavirus experts, with decades of experience responding to and controlling outbreaks. The risk of a pandemic caused by this outbreak and the overall risk to the American public and travelers remains extremely low.
The CDC FAQ that landed May 16 does something the earlier disease outbreak notices didn't. It puts Andes virus right in the title of a public-facing guidance document, not just a technical bulletin. That matters because now the public is being handed the strain name directly.
Right, but I went looking for the line that tells an exposed passenger when to actually walk into a clinic, and the CDC excerpt mostly leans on risk to the American public remains extremely low. That's a population statement, not a decision rule. If you were on the Hondius, it still doesn't answer your question.
To be fair, CDC does point to the 2018 Delaware case as prior Andes-specific contact tracing experience. So this isn't brand new territory for them. The separate question is whether that protocol is actually running now for the 41 monitored Americans.
PHAC confirmed a BC resident through provincial lab testing on May 17. Name province, name process, name lab. So are the Nebraska contacts getting that same kind of confirmation? Or are they still just sitting in the monitored column with no PCR result attached? Canada just raised the bar on what confirmation looks like.
From Public Health Agency of Canada.
Samples from British Columbia were sent to PHAC's National Microbiology Laboratory, NML, in Winnipeg for confirmatory testing. One individual sample was confirmed positive for hantavirus on May 16th. A second individual, who was a traveling partner of the confirmed case, was confirmed negative by the NML.
Update on the Hondius contact tracing thread. Canada has now confirmed one Andes virus case, and the traveling partner tested negative at PHAC's National Microbiology Lab in Winnipeg. That makes PHAC the first named national health authority outside Europe to confirm a case through lab testing, not just an epidemiological link.
I want to know whether that BC resident self-reported or got pulled in by contact tracers, because those are very different stories about how well the net is actually working across 22 countries of dispersed passengers. PHAC says it was reported by the BC Provincial Health Officer on May 16, which reads like a handoff, not a proactive catch.
The statement leaves that sequence blank, and you're right, that matters. What it does confirm is that one high-risk contact, the traveling partner, was tested and came back negative. So close contact does not automatically mean infection here.
One negative traveling partner doesn't close the question for me, but it does mean PHAC actually ran the test instead of just logging the person as monitored. I still want to know whether Nebraska's contacts got the same lab confirmation or are sitting there with no PCR result attached.
RFI writes,
The MV Hondius is expected to dock in the Dutch port between 10 a.m. and midday on Monday, according to officials, before disembarking the 27 remaining people on board, 25 crew and 2 medical staff.
The MV Hondius is due to dock in Rotterdam Monday morning, between 10 a.m. and noon local time. 27 people still aboard, 25 crew and 2 medical staff. Dutch authorities are now the named receiving jurisdiction. So the open question about who's holding the pen on quarantine protocols in Europe is finally getting an answer.
And those 25 crew have been on that ship the whole voyage. Their exposure profile is not the same as a passenger who got off in Tenerife. So when RFI says weeks of quarantine, I want to know, weeks under whose protocol, monitored how, and is that the same window PHAC used when they caught the BC resident?
PHAC confirming that BC case through provincial lab testing is the first time a national health authority outside Europe has put a name and a jurisdiction on a Hondius passenger via actual lab work. That's a surveillance milestone, even if it's still just one case.
Right, but the passengers are dispersed across 22 countries. Canada ran the test and published the result. Who else is doing that, and who's just keeping someone under monitoring without ever running the PCR?
AP News writes,
In the last week, the remote outpost has found itself at the center of speculation about the source of a deadly hantavirus outbreak on an Atlantic cruise after Argentina's health ministry said it was examining whether the outbreak's first victims, a Dutch couple who died in April, contracted the rat-borne virus there.
AP is datelining this from Ushuaia Today, which makes it the first named, sourced story on the economic fallout, not a tourism board release. The Argentine health ministry is being precise. They can't rule out any destination the Dutch couple visited during their months-long road trip through Argentina and Chile before boarding in Ushuaia. That is not confirmation of Ushuaia as an exposure site. It's an open epidemiological bracket.
And Ushuaia's local authorities are calling it a smear campaign, which tells you how that bracket is landing on the ground. The people booking the next Antarctic cruise aren't parsing the health ministry's careful wording. They're seeing Hantavirus, Ushuaia, cruise ship in the same headline.
Worth holding that against where we started this week. Strain ambiguity, no named exposure site, passengers scattered to 22 countries. The ARC has moved. CDC has named Andes virus in a public FAQ. PHAC confirmed a BC case through lab testing, and the ship docks Monday. None of that settles the Ushuaia question, but the reputational damage is running ahead of the epidemiology either way.
Magellanic penguins are not the public health problem here. The problem is nobody has told the next wave of Antarctic cruise passengers whether Ushuaia is cleared, still under investigation, or just quietly dropped. That's the gap the AP story is sitting in.
CBC News with Maya Tostanek.
A hantavirus outbreak aboard a luxury cruise ship this month has put the spotlight on a deadly disease that has no cure. Hantavirus cases are rare and typically not contagious between humans. When people do catch it, it is usually after touching objects, eating food, or inhaling particles contaminated with rodent droppings or urine.
CBC ran a treatment and vaccine piece today, and the number to anchor on is 40%, the case fatality rate for hantavirus pulmonary syndrome in the Americas. That's the backdrop for every bit of this years-away vaccine talk. This is not a disease where you wait around for a cure and hope supportive care does the rest.
And years away is carrying a lot of weight in that CBC framing. The BC passenger FAC just confirmed is dealing with a virus that has no dedicated treatment right now, today, not in some future pipeline. So what does supportive care actually look like for hantavirus pulmonary syndrome when a patient shows up at a Canadian hospital that may never have seen an Andes case?
That's the gap the CDC FAQ published Friday doesn't fill. It tells exposed passengers when to seek care, but it doesn't spell out what that care is, because the honest answer is that there's no targeted antiviral for this strain. The research funding story and the contagion control story are moving on completely different timelines. If you follow Hantavirus Watch to stay ahead of health risks, you might also like Food Recall Watch, daily FDA and USDA food recalls, allergy alerts, and Outbreak-linked notices. Find Food Recall Watch wherever you listen to podcasts. We've put links to all of today's stories in the show notes, so if one caught your attention, you can follow it there and read a bit deeper. That's Hantavirus Watch for today. This is a Lantern podcast.